Hi, it's Nadim Aslam here. I'm an orthopedic consultant. I specialize in robotic hip and knee replacement surgery. I'm delighted to report that last year we've done more cases than anybody in Britain, which is a great achievement for not only myself, but the whole team and Spire South Bank Hospital. My journey started 6-7 years ago when I started to look into minimally invasive surgery. I was approached by younger patients who wanted to have minimally invasive approaches, less damage to the soft tissue, and wanted to get back to work within 2-3 weeks. It was surgery that involved a lot of training, involved cadaveric workshops both in London and abroad, and we started with minimally invasive techniques such as the super path technique, and then we went to London and trained with surgeons looking at the direct superior approach and other minimally invasive techniques. What I found was quite remarkable, that the patients who traditionally had 20 to 30 centimeter incisions, a lot of swelling, a lot of bruising, and limped on crutches for many days, were transformed into now patients who had incisions around 6 to 8 centimeters. They had less minimal bruising, less swelling, and they were able to get up and walk much more comfortably. In fact, we routinely now allow patients to lie on their side, and we aim to let patients drive up 2 weeks. This outcome, which we saw after our minimally invasive surgery, was so great that we now do this for all ages, because we believe that the minimum that you damage the soft tissue, the less the inflammation and pain and the better the recovery. Now, the difficulty you have in orthopedics is that a lot of surgeons say they do the same operation, but there is a big variation between your surgeons, and you must do your research and look into what your surgeon does. We, in our minimally invasive approach, we don't release any muscles or tendons. We go between the muscles and go directly onto the hip joint. We sublux the joint, and then we will cut the hip in position. We don't dislocate the hip. We remove the femoral head, and then we build the hip within the soft tissue structure. Therefore, the rehabilitation and the function is much quicker at an early stage. Most surgeons will release structures such as the piriformis and other muscular tendinous structures, and they will, although they will repair them on, that recovery, that scarring and that healing delays the initial enhanced recovery. So these minimally invasive techniques were something that we had taken into account for many years, and the latest PROMS data, which is national independent data, showed us to be positive outliers with outcomes which were amongst the best in the country. Then after this minimally invasive surgery, we started to get involved in robotic surgery. We felt that robotic surgery was the way in the future, that we could develop more accuracy in our operations. One of the criticisms of minimally invasive surgery was that there was not accuracy in terms of positioning of the implants, which is not something that we found, because we actually got very good views and we didn't have a problem with that. But this is a misconception amongst some surgeons and patients. With robotic assisted surgery, we're now able to plan your surgery much more accurately. We know exactly what the implants are before we're going into the operation, and we are able to plan three-dimensionally the operation that you require. We're able to make adjustments during the operation to deliver to you what we feel is the perfect position for the joint. That, combined with the minimally invasive techniques, we believe is the gold standard for us, and will give the best outcome for our patients. And we are more than happy to have visitors to come visit and see the type of outcomes in surgery that we've achieved. But we hope that this will be the future for you, and we're more than happy to see you if you require further assessment. Thank you.